everyone. In this class, we'll try to learn about what is conducting system of the heart. The learning objectives would be to name the parts of conducting system of the heart, appreciate the importance of AV nodal delay, explain the mechanism of AV nodal delay, give the conduction velocity in different cardiac tissues, and understand the propagation of electrical impulse in conducting system of heart. The conducting system of the heart mainly comprises of SA node, internodal pathways, AV node, His bundle, bundle branches, and Perkins fibers. So this is the diagram of the conducting system of the heart, which is going to initiated in the SA node. So then the impulses are transmitted to the AV node, AV bundle, and the left bundle branch and the right bundle branch. Then it gives rise to Perkins fibers, which is going to stimulate or causes the excitation of the ventricular muscle mass. SA node. It is the primary pacemaker of heart. It's located in the right atrium close to the opening of superior vena cava. It is about 1.5 centimeter long and 0.5 centimeter wide. Contains pacemaker cells which generate impulses for excitation and contraction of muscles. The action potentials from SA node of slow response type, and the velocity of conduction of impulse in SA node is slow, that is 0.05 meters per second. Internodal pathways. 3 internodal pathways that connect SA node to AV node. Those are called as anterior internodal pathway, which is called as tract of Bachmann, middle internodal pathway, and posterior internodal pathway. They're called as tract of Wenckebach and tract of Thorel respectively. The velocity of conduction of impulse in internodal pathway is about 1 meter per second. From SA node, a conducting tract arises and directly enters into the left atrium. So this is called as intra-atrial tract or Bachmann's bundle. AV node. The location of the AV node at the lower part of the right atrium close to the interarterial septum and just above the atrioventricular ring. So it has 22 millimeter in length and 10 millimeter in width and about 3 millimeter in thickness. The AV node, the fiber diameter is small and there are multiple sub-branches. Therefore, rate of impulse conduction is slow in AV node, that is 0.05 meters per second. Usually a delay of about 0.1 second occurs for the impulse to be transmitted through AV node. So this is called as AV nodal delay. So this delay is shortened by sympathetic stimulation and lengthened by parasympathetic stimulation to the heart. The ability of AV node to slow down the transmission of rapid impulses from SA node to the ventricle is also called as decremental conduction. The action potentials generated in AV node are of slow response type. Pacemaker cells are also present in AV node, but normally AV node is not pacemaker because the rate of impulse is lower than that of SA node. The pacemaker cells of AV node are suppressed by SA nodal impulses. However, when SA node stops conducting impulses, AV node becomes the pacemaker of the heart. His bundle. It arises from the AV node and terminates in the Perkins system. They are located below the AV node and passes towards the interventricular septum. So they are 1 centimeter in length, which on entering the interventricular septum divides into right bundle branch and left bundle branch. When SA node and AV node are defunct, the bundle of His generates the impulses. Bundle branches. His bundle branches divides into 2 bundle branches. Right bundle branch. This is longer and thinner than the left bundle branch and exclusively supplies the right ventricle, whereas left bundle branch bifurcates into two divisions further into anterior division that supplies the anterior portion of the left ventricle and posterior division that supplies the posterior lateral part of the left ventricle. The bundle branches either enter the ventricular wall then the branch out to form Perkins fibers. Perkins fibers is a network of conducting fibers that are present in the subendocardial region of right and left ventricles. The Purkinje cells are the largest cells in the heart. The numerous gap junctions are present because of the larger diameter of the fiber and the presence of gap junctions. The rate of impulse uh, of uh, conduction is highest in the Purkinje fibers. The conduction rate is almost 4 meter per second. The action potential generated in the Purkinje fibers are of fast response type. So here this table shows the conduction velocity in different tissue. SA node it is 0.05, internodal pathways it is 1 meter per second, at AV node 0.05, His bundle 1, and it is maximum in Purkinje fibers, that is 4 meters per second, and in ventricular muscles it is 1 meter per second. So this is how the initiation and propagation of the cardiac electrical activity occurs. So here the atria, they're excited. So then the septal depolarization, this is the apical depolarization, and this is extension of the impulse into the ventricular mass. So at the last, the basal part is excited. The electrical activity is initiated in the SA node and spreads in an orderly fashion. The wave of depolarization spreads in all directions to right and left atria directly into the AV node via internodal pathways. However, impulse from atrial muscle cannot directly excite the ventricular muscle because of the atrioventricular ring. Therefore, transmission of electrical activity from the atria to the ventricle occurs only from the AV node through the bundle of His. Conduction slows in AV node. This takes about 60 to 90 milliseconds to excite the atria. The conduction of impulse through AV node occurs at much slower velocity, that is 0.05 meters per second. Thus, the transmission of impulse is delayed in AV node for about 0.1 second. So this is called as AV nodal delay. The slower conduction velocity in AV node is due to three factors, that is small size of the nodal cells and their branching pattern, and slow upstroke of the action potential which occurs due to the slow voltage gated calcium channels, and weak electrical coupling as a result of relatively few gap junctions. Importance of AV nodal delay. Physiological and clinical importance of AV nodal delay is that it allows the ventricular filling. Due to the AV nodal delay, the atrial depolarization completes much before the beginning of ventricular depolarization. Therefore, when atrial systole occurs, ventricle is in diastole. This helps in ventricular filling to occur. It maintains the low ventricular rate in AF. Rate of atrial depolarization is very high as occurs in atrial fibrillation. In such condition, all electrical impulses from atria cannot reach the ventricles because of the inherent AV nodal delay. Thus, ventricles contract at lower rate than the atria. Then such drugs such as digitalis, beta blockers, etc. reduce the heart rate by partly promoting the AV nodal delay. Vagal stimulation, it leads to AV nodal block. Conduction is rapid in ventricles. The impulse spreads rapidly into the ventricular muscles via his Perkins system. The Perkins system is composed of fibers with a large diameter. The slope of depolarization is also very steep. Therefore, conduction velocity is maximum in Perkins fibers. The wave of depolarization takes about 0.08 to 0.1 second to spread rapidly from the top of the septum through the Perkins fibers to all the part of the ventricles. Depolarization of the ventricles starts at the left side of the interventricular septum and then crosses to the right side through the interventricular septum and then spreads down to the apex of the heart. Then it depolarizes the muscles in the wall of the ventricle from endocardial to the epicardial surface. In ventricles, the endocardial surface depolarizes before the epicardial surface. The portion to be depolarized last are the posterior-basal portion of the left ventricle, the pulmonary conus, and the uppermost portion of the septum. The process of repolarization of the ventricular muscle occurs almost in reverse direction. The conduction velocity through ventricular mass is 1 minute per second, 1 meter per second. The complete excitation of the both ventricles, it takes about 7.75 milliseconds. Okay, so this is the time required for the impulse to reach to the AV node, that is 0.2 second. Then 0.18 it reaches the apical impulse, and 0.22 second it almost reaches to the basal part of the heart. So this is in brief about the conducting system of the heart. Thank you.